Another day, another video of first aid by pinched nerve in the shoulder, causes, treatment and prevention. If you've ever experienced a pinched nerve in your shoulder, you know just how painful and uncomfortable it can be. This common condition can make even simple movements difficult, leaving you feeling frustrated and in pain. In this blog post, we'll discuss what a pinched nerve in the shoulder is, what causes it, and how to treat and prevent it. What is a pinched nerve in the shoulder? A pinched nerve in the shoulder occurs when a nerve is compressed or irritated as it travels through the narrow passageways of the neck and shoulder. This compression can cause pain, numbness, tingling, and weakness in the affected area. The condition can occur at any age and can affect anyone, although it is more common in people who perform repetitive motions, such as athletes or those who work in manual labor jobs. What causes a pinched nerve in the shoulder? There are several causes of a pinched nerve in the shoulder, including poor posture. Poor posture can often be the cause of a pinched nerve in the shoulder. Poor posture can include slouching, carrying too much weight on one side of the body, and not using proper ergonomics while sitting or standing. All of these can cause the shoulder muscles to be overworked and can lead to a pinched nerve. To avoid this, be mindful of your posture throughout the day and make sure your shoulders are in a neutral, relaxed position. Additionally, use ergonomic office furniture and take frequent breaks to stretch and move around. Repetitive motions. Repetitive motions can cause a pinched nerve in the shoulder. This happens when the shoulder joint is overused, resulting in the nerve being compressed or pinched between bones, muscles, or other tissues. Symptoms of a pinched nerve in the shoulder can include pain, numbness, tingling, and weakness in the shoulder and arm. Activities that involve repetitive motions, such as playing sports, lifting weights, or doing a job that requires a lot of overhead arm movements can all put strain on the shoulder joint and lead to a pinched nerve. Taking regular breaks from activities that involve repetitive motions can help reduce the risk of developing a pinched nerve in the shoulder. Injury. A pinched nerve in the shoulder is caused by compression of the nerve in the shoulder joint. This can occur due to bony abnormalities, such as bone spurs, or due to swelling of the tendons and soft tissues around the shoulder joint. It can also be caused by overuse of the shoulder joint, such as repetitive overhead activities or activities requiring a lot of shoulder mobility. Postural issues, such as spending long periods of time in one position or carrying a heavy bag, can also contribute to pinched nerves in the shoulder. Treatment for a pinched nerve shoulder usually involves rest and the application of cold or hot packs to the area. In more severe cases, physical therapy or medications may be necessary. Herniated disc. A herniated disc, also known as a slip disc, is a condition in which the cushioning discs between the vertebrae of the spine become displaced and press against the surrounding nerve roots. This can cause a pinched nerve shoulder, resulting in pain, numbness, and tingling in the affected area. Common causes of a herniated disc include trauma, such as a fall or a car accident, and age-related degeneration of the spine. Other risk factors include obesity, smoking, sitting for prolonged periods of time, and excessive physical activity. Treatment for a herniated disc usually involves physical therapy, medications to reduce inflammation and pain, and possibly surgery. Arthritis. Arthritis is a common cause of a pinched nerve shoulder. It occurs when the cartilage between the bones of the shoulder joint wears away, leading to inflammation of the joint and surrounding tissues. This can compress the nerves in the shoulder, causing pain, numbness, and tingling in the shoulder and down the arm. Arthritis is a progressive condition, meaning it will get worse over time, and it affects older adults more than younger ones. While there is no cure for arthritis, there are treatments available to help control the pain and reduce inflammation. These include medications, lifestyle changes, physical therapy, and in some cases, surgery. How to treat a pinched nerve in the shoulder. Treatment for a pinched nerve shoulder depends on the severity of the condition. Mild cases may be treated with rest, ice, and over-the-counter pain medication. More severe cases may require physical therapy or prescription medication. In some cases, surgery may be necessary to relieve pressure on the nerve. Here are a few home remedies that may help alleviate the symptoms of a pinched nerve in the shoulder. Rest. Avoid activities that cause pain and rest your shoulder as much as possible. Ice. Apply ice to the affected area for 15 to 20 minutes at a time, several times a day. Heat. After the first few days, you can apply heat to the affected area to help improve blood flow and relieve muscle tension. Stretching. Gentle stretching can help relieve tension in the affected area and improve mobility. Massage. A gentle massage can help improve blood flow to the affected area and alleviate muscle tension. How to prevent a pinched nerve in the shoulder. Preventing a pinched nerve shoulder involves taking steps to reduce your risk of developing the condition. Here are a few tips to help prevent a pinched nerve in the shoulder. Maintain good posture. Good posture can help reduce pressure on your neck and shoulder, reducing your risk of developing a pinched nerve. Take breaks. If you perform repetitive motions, take breaks to rest and stretch your shoulder. Exercise regularly. Regular exercise can help improve strength and flexibility, reducing your risk of developing a pinched nerve. Lift with care. When lifting heavy objects, use proper form and avoid lifting with your arms extended. Avoid sleeping on your side. Sleeping on your side can put pressure on your shoulder, leading to a pinched nerve. Try sleeping on your back instead. In conclusion, a pinched nerve in the shoulder can cause a great deal of discomfort, and can even lead to long-term nerve damage if it is not treated properly. Treatment options vary depending on the severity of the injury, but may include physical therapy, medications, or even surgery in some cases. If you are experiencing any pain or discomfort in your shoulder, it is important to see a doctor for proper diagnosis and treatment.